Welcome, everybody. How are you doing? My name is Rocio Gonzalez with the Latin American Chamber of Commerce. Thank you so much for coming to the LACCC Mid-Year Conference 2020, the second session. This morning, we had stellar interviews and wonderful people that joined us. We had polls, interactive activities. We had breakout rooms for everybody to network. And we have the same joy and the same fun and energy for the second part of this conference. We're going to be together until 3 p.m. Please join us for the whole duration because we're going to have a lot of wonderful people as well. In the next 2 hours, I want to thank each and every of the sponsors because without them, we will not be able to have this support. We would like to thank Mid-Museum, Wells Fargo, ACNM, Greer Walker, Bank of America, Norsan Media, Fifth Third Bank. We want to thank Atrium Health, La Noticia, Novant Health, Lowe's, and Nationwide, State Farm, Blue Cross Blue Shield NC, Something Classic, Compass Group, Charlotte Knights, Food Lion, Compare Foods, Wingate University, UNC Charlotte, True Lion, Accenture, AT&T, People's Bank, Sharon View Federal Credit Union, Latour Insurance, Thompson Children and Family, Bojangles, and Walmart. Thank you so much. Thanks to all of these corporations that support us and help us continue to provide support to the small business community. For this afternoon, we are going to have wonderful leaders in the private and public sector. We are going to hear words from Norberto Sanchez from Norsan Media, Lina Varela from Novant Health, Gustavo Bernal from Blue Cross NC, and Patti Juarez from Wells Fargo. Also, in between all of these activities, we're going to have polls and breakout rooms, like I said, so that we can have networking and you can meet some of the members that are participating here. And for the very end, we want you to stay for the end because this is going to be very, very fun. We're going to have a motivational speaker. His name is Justin Jones-Fosu, and he is going to speak about live to a different beat. So it's going to be an extremely energetic and motivational presentation. And now I would like to introduce to you the first speaker is going to be Norberto Sanchez, CEO of Norsan Media.
Hello, everyone, and welcome to the Latin American Chamber of Commerce Mid-Year Conference for 2020. My name is John Rojas, and I am a financial consultant with RGP Consulting, specializing in financial planning and analysis. I'm also privileged to be and serve as the treasurer of the Latin American Chamber of Commerce. It is my privilege today to welcome Mr. Norberto Sanchez, one of our most dynamic and local businessmen. Norberto, would you introduce yourself, please?
Thank you, John. It is a pleasure to be here. It's an honor to be here in the Latin American Chamber of Commerce Conference, the Mid-Year Conference 2020. Again, my name is Norberto Sanchez. I'm CEO of Norsan, a company based out of Atlanta and also Charlotte and Jacksonville, Florida. It's a pleasure to be here. Thank you, John.
Norberto, these are very challenging times. That goes without saying. Let me start by asking you first, tell us a bit about your organization that you represent, that you're the CEO and chairman of. And what has this period been like for you? What challenges have you faced?
Wow, John, this is unprecedented times, as everybody would know. I remember back in 2008, when we faced, the financial, the toughest financial crisis, in our country. And I thought, man, this is horrible,
Right.
And I thought, I said, this is something like this will never happen again, or it's going to be very difficult, But anyway, now we're facing COVID-19, and it is even a much bigger challenge for any organization, not only here in the U.S., but in the world. So it's been tough times, it's really tests the organization, especially for us, as you probably know, we are in 3 different industries. We're in media, Hispanic broadcasting. We are in also food distribution. We serve supermarkets, restaurants across the east coast of the United States. And also we're in the toughest business that there is right now, which is the restaurant business. We have 18 restaurants in the between Atlanta and Charlotte, so it's been unprecedented time. It's been very tough, but it has tested the organization. And I'm very glad to say that we're going to make it. But definitely we have made major changes in the organization and the way we act.
Well, the fact that you're here, Norberto, is indicative of your fiscal strength, and I congratulate you for that, because only the strong will survive. Share your experience, please, in leading Norsan Media during the time of uncertainty. For instance, how do you redefine success now with the coronavirus?
Well, success right now, first of all, we need to establish the priorities and that was the first thing that we did. We saw in the first week, basically of when really COVID became a real threat, to the economy here. And I can say probably was the after the first week of March, the first thing that I did is I said, I remember that movie when he says, when an airplane was getting ready to crash and you say brace for impact. So the first thing that I did, is to call a general meeting to everybody in the organization to say, hey, brace for impact. This is going to be tough. We don't know where we're going into. And I know that it's going to be very difficult for the whole organization. So I didn't know what was that impact going to be. But, we knew that there were going to be a completely structural changes to the organization, the way we act. So we established 3 priorities. The first one is to be sure that, the most important one was the well-being of our coworkers and the, in the health. That was very important. Number 1 priority. Number 2, the health and the well-being of our providers and our customers. That was number 2. And the third was really focus our company to the business continuity. After this, because at least the only good thing that we know about this is that it's a finite event. There'll be something that there'll be a time when this is over, and hopefully we will survive. And let's prepare the company to be sure that we're standing with the 2 feet prepared. Because at the end also there'll be some opportunities. That after all this, as you mentioned, only the strong will survive. I think the strong and the one that have the resilience to be here and prepare themselves, not only before, because you didn't have time to prepare, but really prepare yourselves through these big difficult times, to be sure that you're getting ready to get out and be sure that you're able to take also opportunities, for the benefit of the company. So business continuity was the third. And as we continue to be sure that we take care of our coworkers as number 1 priority, and number 2, be sure that we take care of our customers, which has been challenging, and I can elaborate a little bit more on that, in the restaurant business especially. But the focus, laser focus on the business continuity. That's now what we've been working. My leadership team in each of the companies, in each of the divisions, we've been focused, on really concerned about the business continuity of the whole company.
Norberto, and I agree. I think one of the strong points that you just made was your frankness. You did not sugarcoat, and I think you were very direct with your employees in saying, like to quote you, brace for impact. In other words, you did not try to sugarcoat that this was going to be an issue. As a leader in your industry, what is your message now for the future? As you look forward and you've taken care of the situation and the problems, what do you recommend for our community and other businesses to do in order to continue to make progress in this environment?
Thank you, John. the advice that I will give is something that we follow, and it's not easy, to be honest. It's been very difficult, at the personal level, because, my company, we started from scratch with, zero coworkers. And right now pre-COVID, we had about 1,100, coworkers in the company. A lot of them being with us for a long time. They've been for us with 28 years or so, or some of them 30. And the biggest challenge that I had, was to make those tough decisions, because you have to select who is going to be the people that will stay with you, that will help you have that business continuity. So it was very tough, and it continues to be tough, because as we speak, yesterday I have to take, a couple of decisions that were very sad for me, because when you take the human capital, which is the most important asset in my company, in all the companies, it's difficult to make those decisions, but we have to make them not only, for being greedy, is really for the continuity of the business, so it's for the families that will depend on this business for now and the future. So, I think that the best advice is that, we need to breathe deeply, make those decisions, being human, be as human as possible, to be sure that you're feeling their concerns. So the people where you're making these decisions, where you're cutting jobs or making salary decreases or something like that, we need to be sure that, we take those decisions, because the business, depends on that, so, that's been the toughest, and my advice is to be sure that, don't be shy. I mean, it's a tough time. People will understand at the end of the day, maybe not right now, but they will understand that when you're making those decisions are for the benefit of the company and the families that will depend on this business in the future. So that's my best advice, be sure that take those decisions, because your business continuity depends on that.
Yeah, it's true what you're saying. And I'm sure that you're also keeping those names of people who have been with you for decades at the top of the list. So when the rebound comes, you'll be talking to them again, I'm sure.
Yeah, that is correct, John. It becomes when, pre-COVID, you were thinking about, re-engineering, and you're thinking about, strategy positioning, your company, each of the divisions in the best way possible. Well, now, you have to be thinking, from here to December, at least, that's my milestone that I set up for the company, to be sure that we have the right people, and we have become an operational company. Basically, let's operate in the most efficient way, reduce cost as possible, because cash and liquidity are the most important part right now for any company.
As the saying goes, the age-old adage, cash is king or queen.
Yes. Yeah, you're right about that. So we've been focusing on that. I mean, we've been blessed to be able to participate in some of the PPP, the programs from the SBA and so, and some help, but we were blessed to be able to be economically strong before, pre-COVID. So we were, again, blessed to have those lines of credits available to us that help us, when all of a sudden, your business stops dramatically one day and you don't have any income, especially talking about the restaurant division. It makes it very tough, because you still have expenses coming up in the back end, and you don't have the cash flow, to be able to pay. So, it was for us, we were blessed to have that is, financial position in a strength, that such a way that we will able to be able to defer, a lot of these major expenses that we had.
Right. And that's another set of difficult decisions.
Yeah.
So for now, to wrap up, Norberto, what words of wisdom do you have for us?
Well, again, I think, things will get better depending on the industry that you are. We see in the media business, if I can give you my 2 cents there, of course, the first thing that you got, when you're running a business is advertising. It says, yeah, but the first thing that you need to be able to bring the revenue back is to be able to advertise, to be sure that everybody knows that you're open, that you're in business. So, in that industry, I see, a great potential. Of course, we have other challenges like the, establishing, the digital platforms that we are, really focusing on, in that regard. For restaurants, it's just, pray that, people will stay safe. And that's a big challenge that we have because, some customers don't believe that COVID is very damaging, and which it is. Personally, we have had some families and friends that have been sick and very sick. So I know that is true. That is a fact that this is real. So we need to be sure that we protect my people, the people that work at the restaurants, and be sure that we take every single precaution to be sure that our guests are safe, our people are safe, and also our providers are safe. And and restaurant will come back, but we need to be sure that we bring in people back to work as the business grows. So we need to be taking the pulse of the business every single day. Small groups to make decisions. Leadership groups within each of the divisions. That's what I'm doing every day. We used to see each other like every week or so. Now it's every day, 7 days a week. Because it's important to manage this crisis. It is important to be, on top of what is going on in every single division, in my case, or every single business that you are. And for the, meatpacking company, we were tremendously blessed to be diversified because, the restaurant business went down. Yes, it came down. People start restaurants open to curbside, to go orders online or whatever. So we pick up again, some of that business, but we also serve supermarkets. In supermarkets, our business, our volume grew 250%. So that division is the one that really helped us also propel, and keep our whole group of businesses safe because we, to be honest, we make record, profits, in the last 2-3 months, just because the prices of meat increased dramatically, and we, maintain a margin, and our business grew. So we, being diversified, in my case, really help us out. I think, you get the potential and the opportunity to be diversified yourself. That's key. I think that is key. They're not depending on only one single business, especially because I think that this pandemic or pandemic or the COVID-19, virus and the way, that happened, as the doctors, the, people, the scientists, they believe that this is going to be recurring. So we need to be prepared for that, So we need to be prepared for that, not only for the financial crisis, but also for, another recurrence of another virus, in the future.
Well, Norberto, thank you very much. On behalf of the LACC board, I thank you for your time, taking the time to talk to us and to share your experience. A truly inspiring story. And we would like to take this opportunity to wish you and your company the best. And please stay safe.
Thank you, John. It's a pleasure. It was an honor to be here. Thank you very much. Thanks for what you're doing in the chamber. It is very important that we continue to support the chamber for many years to come. So thank you, you and our, President Rocio also. Thank you very much for being there and appreciate it. And good luck. Stay safe, please.
Wow, wonderful words. It's very wonderful to know that we have leaders like Norberto Sanchez in our community. I would like to introduce to you Debbie Ortega. She is our LACC Events and Programs Manager and also part of the team that has ensured that all of this is working wonderful. Debbie, say hello, please.
Hi, everyone. Thank you so much for joining us today. If you are joining us for the second session because you were in the first session, thank you so much for coming back. I know lunch sometimes makes us sleepy. And if you are joining us for the first time today, we are so happy that you are here. And I can't wait to see what you get out of today.
Thank you. And now we would like to have provide you with the opportunity of getting to know one another. We're going to move into our breakout rooms, which will provide you a chance to speak for about a minute. We're going to divide you in groups of 4 so that you can have 5 minutes and talk to one another, build business connections. And this is one of the fun fun parts of our session. So Debbie, if you could please send us in our groups, thank you, and then stay back and come back to the main room.
All right, everyone, I'm gonna whisk you away real quick and you'll have 5 minutes. Welcome back, everyone. We hope you enjoyed that mini speed networking session. We will have another one come up later in the program today. But for right now, we are going to go ahead and move into our next speaker, which is going to be Lina Varela from Novant Health. Enjoy.
Hello, everyone, and welcome to our Latin American Chamber of Commerce Charlotte Mid-Year Conference 2020. My name is Rich Robles, and I am the Senior Director of Diversity, Inclusion, and Equity at Novant Health. I also get to have a role in the Latin American Chamber of Commerce Charlotte. I'm part of the board, and I get to build relationships with our community, as well as get to talk to leaders who are making a difference in our communities, not just for the Latino community, but also for the entire city of Charlotte. So this morning, I'm also joined by my colleague, Lina. And Lina, I want to turn it over to you for an introduction.
Hello, Rich. Thank you so much. My name is Lina Varela Gonzalez, and I am the Director of Nursing in the Emergency Department at Novant Health Presbyterian Medical Center. And it's an honor for me to be here today to talk to this community about what we have been working with in Novant Health and just having the opportunity to connect with you.
All right, thank you, Lina. And I'm so excited to be having this discussion with you. So I want to get into we're going to be doing some questions and talk about what we have been experiencing and seeing. So my first question for you is, what has that been like for you in the last 3 to 4 months and everything that has transpired for us?
Wow, Rich, that's a loaded question. I'm just being able to sit back and think through what we've been through in the last 3 to 4 months. You know, the pandemic has been a life-changing event for everyone, not just within Novant Health, but also within our communities. We have been managing some fear, some uncertainty, but also a lot of heroic and courageous work. Working through the pandemic, we have learned that we need to be agile and that our normal day-to-day work is no longer normal, and that we must shift to be able to care and work through the pandemic in an environment that is unknown to us. And that has been successful to us due to the team effort and our core value of courage, and being able to say, this is hard, and we have some fear, but we're also going to be able to continue to move forward. And how we move forward is just shifting our mindset and being open to new practices and challenging new practices that we probably have not done before, or that we have done before and just had to work through some regulatory components. So that's how we have been able to manage and work through the pandemic. I think the other important thing about this is not losing focus on what's more important. And what really is important is our people. We are in healthcare to take care of our community, so it is our purpose. And that's how we have been able to lead in our business, by focusing on what really matters, and that is our patients and our team members.
So Lina, thank you. And like you said, and what really matters, our patients and our team members. You spoke a little bit about the heroic acts and the heroic pieces that you have seen throughout this. Any ones that you care to mention where you have seen someone step out and exercise courage and help our patients and team members?
Wow, Rich, there's so many of them that though I could take this entire time to just share names of our team. Not only is it our team members that are showing heroic work and our leaders within our organization, but our community. To me as a nurse and as a leader within the healthcare, it has been extremely rewarding to see how the community has come together to support one another. We've had several donations around foods, masks, and what can we do to combine the supports in caring for our community. It's been, I think that's what's been the most heroic. We typically don't see those efforts, and our community and our patients and our team members have really stood out in stepping outside their normal day-to-day efforts to care for one another.
Thank you, Lina. And you're right, as we, being part of a system, Novant Health, and how we have been exercising our core values of courage, compassion, and also diversity and inclusion. Can you talk a little bit more about that inclusion part around how we have been taking care of our patients and having conversations with our team members?
Diversity and inclusion is one of our core values, and we have done an enormous work around making sure that we are connecting to communities of lower resources. And by that, I mean we have focused on having screening centers, in communities where we know we have a disproportion of healthcare and resources, and to be able to not only screen our patients, but educate our patients and our family members within our community to be able to safely care for themselves and each other. We've provided our community with masks throughout this pandemic, as we know that we had a lacking of sources of masks for a while. So as an organization, going back to what our purpose is of caring for our patients and our community, we're going out there to provide our community with the resources that we need to keep ourselves safe.
Yeah, Lina, you're talking about, the screenings and what our team members have been doing for our patients and our community. What have you had to shift in our emergency department to keep everyone safe? And by everyone, we mean our patients, our team members, and people in the community and family members who come in contact with our hospital.
Emergency medicine, nursing is in my blood. That it drives my adrenaline, and that's one of the reasons why I went into nursing. And one of the things that we've had to shift is be the calm to the fear. We have seen many of our patients come in and family members extremely fearful of getting sick or hurting our patients or hurting other patients or hurting our team members. So we've had to be that voice of calm, that voice of education, that voice of setting reality versus all the news that goes on there, and then being that resource to our teams. There's many times that I did not know the answer of what was next or how we were going to shift our workflows around caring for a patient, and just being honest with our team members and including them in the decision making has made this team stronger, not only for our team, but for our community and how we've shifted within the organization.
All right. So Lina, talking about the last piece of shifting the organization, what do you see in the foreseeable future? Where does our organization need to change to be able to continue thriving in the middle of a pandemic, but also what's after COVID-19?
Rich, I think quarantine people in their homes have probably shifted the way that we deliver care to our patients in our communities. And we have probably shifted to providing telehealth permanently to our patients and communities. Prior to the pandemic, we had a lower rate of using telehealth or telemedicine for our community, and now it's the norm. We're seeing patients and family members connecting on a daily basis with our physicians and our healthcare team, from basic well visits to a thorough examination. So I think we are probably shifting to using more technology in how we deliver and connect with our patients day to day. And I think the other thing that we're seeing within our healthcare system is the shift on some of the regulatory barriers that we had prior to the pandemic associated with technology and healthcare. So I think that is shifting within our healthcare system.
All right. So Lina, something that we talk about within our organization in helping our organization shift is the resilience and the courage and the compassion that we need to have as leaders. What has helped you stay resilient and navigate these unprecedented times that we're all experiencing?
Rich, it's the purpose. Nurses, doctors, healthcare leaders go into healthcare because our purpose is to care for our community. We want to make sure that we improve the healthcare of our patients, and being in a pandemic, this is what drives healthcare. This is the purpose behind it, and being able to be there when our community and every family needs us the most to practice nursing and medicine and help someone get better. That is the driver to keeping me resilient and just grounding me in my purpose. The other thing is the team that we have within the emergency department and within Novant Health. It has been amazing to see the team effort and the compassion and collaboration that we've had within every aspect of the healthcare system, from material services, from finances, nursing, technology. We are one team that has been pushing forward to stay healthy and help our community stay healthy.
Thank you, Lina. I like that piece, how we help our community stay healthy. So I would like to end with this, general question around what words of wisdom would you have for our community, not only as our leader in our emergency services, but also as Lina Varela Gonzalez. What would be that nugget of wisdom that you would share with us?
So I have a couple, if you allow me to share it with you.
Let's go.
First of all is we gotta keep hand washing. We gotta wash our hands to stay healthy, to help our loved ones stay healthy. The second one is we need to follow the directions that we get around masking and social distancing. This is how we're going to care for each other. But lastly, Rich, my mother always told me, you got to treat everyone with kindness and love. And I tell you that regardless of the type of pandemic that we have, we should never forget to be kind to ourselves, first of all, and to be kind to others. And I think with kindness and love, we can lead through very challenging times. And that's what this year is going to be. This year has challenges, and it will continue to be challenging, but we need to push forward with kindness and caring for one another.
Thank you, Lina. I just can't think of a better way of ending this conversation as a reminder for all of us to be kind to one another and to be kind to ourselves. So thank you everyone for joining today's conversation that we had with Lina. We appreciate all of you being here, and thank you.
Thank you, Rich. Thank you, everyone. Have a great one.
Thank you, Lina, and thank you, Rich. Once again, we have a wonderful wonderful set of leaders that we have in our community sharing some of the information and some of their experiences throughout this time. Now, I am very, very happy to introduce to you from Novant Health, Dr. Jeffrey Hutchings, I'm sorry. Dr. Jeffrey Hutchings is going to conduct our next poll because the community out there has a lot of questions, and we could have just put the answers to the questions, but what better person than to explain these different answers than Dr. Hutchings, who is from Novant Health, and he's going to handle the polls. So if we can go back to the polls, please.
Good afternoon.
And no presentation, please. Good afternoon, Doctor, and everybody. Doctor, if you could please read the question, and we'll engage the polls.
Great. Well, thank you, Rocio. Thank you again for having me, and it's a pleasure to be here. So we'll get right into the poll. So the first question states, what is the difference between a COVID-19 test and an antibody test for COVID-19? I assume everybody can see the possible choices. Is that correct?
Yes, they can see the choices.
The second question, can we move to the second question, or should we give a little more time?
Yes, people are able to scroll down, so go ahead and do the second question, sir.
So the second question asks, when can I remove myself from home quarantine for a positive COVID-19 test? And the third question says, after an infection with COVID-19, can I be reinfected?
Very well. We have the results of the polls now, Doctor.
All right, great. Okay, so we will go to the first question. So what is the difference between a COVID-19 test, sometimes called a PCR test, and an antibody test? And it looks as though a little more than 3/4 chose A, which is the correct answer. So a PCR test, or what's called a polymerase chain reaction, does test for an acute infection. It does test for active infection, whereas an antibody test is screening for past infection. So it's to look and see, have you been infected by this virus, in this case, COVID. So the second response is just the reverse. It says that an antibody test screens for acute infection, and a PCR test screens for past infection, which, as we just detailed, is not the case. And then the third selection says there is no difference, which is incorrect because we just detailed what the difference between the two tests were. So great job for the vast majority. It looks as though folks know the difference between an antibody and a PCR test. So the next question. So when can I remove myself from home quarantine after a positive COVID-19 test? And it looks as though the questions and the responses were a little bit more sort of dispersed. So the correct answer is E. All of the above criteria must be met before individual can remove themselves from home quarantine. So they must be at least 3 days out since resolution of their fever. And that's without using any fever-reducing medication. So that means no Tylenol, which is generically known as acetaminophen, no ibuprofen, which is the generic, excuse me, for Advil. I'm not using any naproxen. So I'm not using any medication whatsoever to keep your temperature down. So that's what we mean by fever-free without the use of fever-reducing medication. So that's the first criteria. The second one is improvement in the respiratory symptoms. As you see there, we mentioned cough and shortness of breath. Those are two of the most common respiratory symptoms that individuals experience with a COVID infection. A lot of times those do progress to pneumonia, which we are seeing multiple complications with respiratory illnesses in the hospital. We've all heard about individuals being on ventilators. So there needs to be an improvement in those respiratory symptoms. And that's very important because what we are finding is even as people resolve with this infection and they're cleared to go back to work, they may still have some cough. So we're actually sort of seeing that several weeks out from people clearing this infection, they still have a slight cough. But they will still be cleared to go back, assuming they meet the other two criteria. And the last one is that 10 days need to have passed since the patient's symptoms first appeared. And here in the office, we get a lot of confusion with that one. They're trying to figure out, is it, do I need to be looking at symptom onset? Is that when the clock starts, so to speak, or is it when I begin to start feeling better? Obviously, that latter is very subjective. When people start to feel better. So we're using the criteria of 10 days since symptoms have first appeared. The fourth answer, which almost about 15% selected, where any one of the criteria are met, as we found out that's incorrect because we know that question E, or response E is the correct answer, that all three of those criteria must be met. And so lastly, last question. So after infection with COVID-19, can I be reinfected? So it looks as though the vast majority, a little over half, said yes. Only 6% said no. But 42% of you actually answered, we don't know. And that is the correct answer. We do not actually know if individuals can be reinfected. Now, with that said, we, a little bit of background, when we first started with the pandemic, we were using this term novel coronavirus. Novel meaning this new virus that we had never seen. Coronavirus there is a family of coronaviruses. We have all had a coronavirus in our lifetime. It is just a very common respiratory virus, respiratory pathogen that many of us have been infected with. But we just hadn't seen this type of one. But a lot of epidemiologists, which are individuals who study about disease, a lot of virologists, who are physicians who study about particularly viruses, we are making the assumption, and once again, we don't have any evidence to this, but we are making the assumption that this virus will function and our body will respond to this virus, an infection by this virus, much in the way that we respond to other members of the coronavirus and other viruses in that sort of family, meaning that our body will manifest an immune response or an antibody response. Antibodies are also called immunoglobulins. Those are infection-fighting proteins that our body produces naturally to fight infection, and that we think that our body's immune response should function appropriately so as to help prevent further infection. But right now, we don't have any evidence to prove that. That is the prevailing theory at the present time.
Thank you so much, Dr. Hutchings. It's been a pleasure to hear all of this information that we keep on thinking about. What is the right answer? Which website should I listen to? Thank you so much for sharing all of your knowledge with us. And thanks again for Novant Health for allowing Dr. Hutchings to take time from his patients to be with us. And now we would like to introduce to you Gustavo Bernal, who is the Senior Strategic Advisor for Blue Cross North Carolina, who is going to be interviewed by one of our board of directors. So let's listen.
Well, hello, everyone. My name is Todd Gill. I'm with the Latin American Chamber of Commerce. I've been with the Chamber going on my 7th year. And this year, I actually had the opportunity to join the Executive Committee as the Secretary for the Latin American Chamber of Commerce of Charlotte. And I thank you and I welcome you to the LACC Mid-Year Conference 2020. And today I have with me Gustavo Bernal. Gustavo's with North Carolina Blue Shield, and I just want to welcome him today as my guest, and we're going to have a conversation regarding his role at North Carolina Blue Shield, along with how he and his team are working through the current 2020 year. So Gustavo, welcome to you, and thank you so much for joining me today in this discussion.
Todd, thank you for having me, and it's my pleasure to be part of this conference.
Well, you know, just to kind of kick the can and open it up a little bit, tell me how you and, you know, North Carolina Blue Shield have been coping with this period of time. Tell us about what you currently do at North Carolina Blue Shield and how you've made it through the first half of 2020 so far.
So, Todd, let me start. I'm original from Bogota, Colombia. I have been in the country for a little over 17 years and with 25 years of experience in marketing and communications with different brands across the Latin American, the Caribbean, and USA market as well. I have been in this role with Blue Cross Blue Shield of North Carolina, brand sponsorship and activation for a little over 2 years. I manage the relationship with Charlotte Hornets, the Greensboro Swans, Carolina Hurricanes, and the newest Charlotte MLS team. Also, on top of that, I manage all the multicultural initiatives that we have in the market. And one of my partners is the Latin American Chamber of Commerce that has been a pleasure to work with them. In previous roles, I worked for the Diversity and Inclusion Market Program for a little over 4 years. I serve in different organizations across the state, and I enjoy bicycles, and I enjoy practice yoga, and of course, traveling. In terms of what we have been doing with these unprecedented times that we are living, well, the first thing that we did is realize that we have to accept the tough change that we are facing, everybody here in our country and actually worldwide. And we need to understand how we are going to work on this new environment, not only work from home like we are doing today, but also how we can connect with our members or our clients, in our case, our members. For me, personally, means that I have to change all the way that I approach to engage our consumers. As I mentioned before, my role is to manage the relationship with teams. So we go with my Blue Cross team to engage people to basketball games, hockey games, festivals, different events that organizations put across the state. So we have to rethink that. And I have been working with our partners to see how we can connect with our community and be more involved on what they need and what the community is looking for. And one of those is with the Latin American Chamber of Commerce.
Well, you know, that's a lot of great information. I appreciate you sharing that. But what I heard you say is you may have tickets to some of the sporting events in the near future. Do you have those contacts that we can kind of talk about offline?
Yes, of course, Todd. I can help you with that. Just let me know and we'll try to do it the best.
Well, it sounds like you have a lot on your plate. Can you kind of expand a bit on how your team has managed over the last several months to work from home? Do you still have quite a few people in the office, or has everyone been working from home like I have with State Farm? We're all working from home now.
Todd, it's the company is very conscious on the situation, and one of our main thing is to keep our employees healthy. So at the beginning of the month of March, on most exactly on March 12th, the leaders sent 50% of the employees to work from home, and the virus start to be more aggressive than everybody expect. So on March the 19th, we work 98% of the employees are working from home, and still today we don't have clear direction on when we are going to go back to the campus, but the company is working on that and take all the security and cleaning and everything so they can offer a good place to work for our employees, because at the end, if our employees know are healthy and safe, we cannot support our members. So that's priority for our company.
Well, considering what you just said, has Blue Cross Blue Shield of North Carolina had to in any way redefine what success looks like during this current time?
Yeah, for us is we have been focused on what means success, and we are transforming the healthcare system. Even before this pandemic start to spread across the state, and we are committed to make the healthcare better, simpler, and more affordable. We learned from this that the changes can present at any time, and we cannot wait for the change arrive. We need to be proactive and change the things as soon as we can. And this pandemic is one of the cases. For example, Blue Cross developed a program that is value-based care, and it's called Blue Premier. It's a program that our CEO and the team put together to work with the hospitals and providers to make the healthcare better, simpler, and more affordable for our members and communities. Second, we currently are working on telehealth policy that is going to be implemented on 2021 to better support our members that are using that tool to connect with the doctors. It has been a tool that a lot of our providers and our members are using to connect during this pandemic. And last but not least, we are making behavioral health care more affordable and more accessible to all North Carolinians and members.
Well, you know, cost just as an individual when it relates to healthcare is so important to us all, because at the end of the day, we all have to utilize healthcare services at some point. So I find it very exciting that more of us will have access through technology to the healthcare that we need. Do you have any rough estimate of how many more people have started to utilize those new services, or what those expectations look like for 2021?
Todd, I don't have those numbers, but I can share that later. I go back to my team and ask for those numbers, but I don't have those numbers with me. What I can tell you is, in the beginning of the pandemic, we switched because we, based on HIPAA, we need to ask the doctors and providers to use a specific tool to do the telehealth or telemedicine. We change based on the rules, and we allow the doctors and the members use their iPhones or their phones to connect with the doctors, and we consider that as a telehealth. So probably our numbers are going to not be exactly, because a lot of people don't download that application. A lot of providers were not ready to implement it. So probably the numbers will be a little off, but we know that a lot of people is using, because doctors included are pushing the people to do it, that for the safety of the staff of the provider, but also for the safety of the person that is going to attend to those facilities.
Yeah, I think you hit the nail on the head. Everyone wants to have a feeling of safety. When you think back to, it sounds like about 50% of the office is working from the location and 50% are working from home. Have you had any significant or relevant concerns for those folks who are going into the office on a daily basis? Or do you have certain procedures in place, maybe scanning for temperature and that kind of thing?
Todd, let me clarify a little bit. We in March 12th was 50%, and a week later we switched to 90%. Today we are 98% working from home. We don't know if that is going to change in the next couple months, but right now it's 98%. And if you have to go to the office, you have to follow a protocol and guidelines that the company put together. All the campus is closed. The only access is to the main lobbies, but you have to be request access to the building, and the senior VPs authorize your kind of access to whatever you need. But no, we don't have any cases in what we take the temperature for that 2% that is working from home. I think that, working at our campus. And yeah, I think they have all the protocols on place and they are following, because we have no reporting anybody with the COVID-19 or any situations that we need to take care.
Well, Gustavo, when you and your team start considering the third quarter into the fourth quarter for 2020 and beyond, what words of wisdom can you tell us as you start moving your team forward, and what type of projects maybe, or what type of expectations do you have as we wrap up 2020?
Todd, it's really hard because we all kind of learn different things from this pandemic. It changed everything, professional and personally, for everybody, everybody around the world. And Blue Cross is not the difference. For us, it has been very challenging moment, and my team, which is in charge of all the sponsorships and activations across the state, has been a challenging season for us. In my case, we need to switch from be sales and more oriented to supply things for the community. So for example, yesterday we did a meal delivery program with the hurricanes to the UNC Rex Hospital in Raleigh, and we are going to provide meals for that people for the next couple of weeks for the health workers at the UNC. Things like that, we have been working with our partners and see how we can support the healthcare workers, the essentials, but also the community. The company, our CEO, Tunde Sutunde, has been committed to support the governor on the 3W campaign. So we are looking how we can implement that message on all our sponsorship. So we have been working on that, and hopefully we will have a very successful season after all these challenging times.
Well, I'm sure that those first line healthcare workers appreciate what you folks are doing for them. They certainly are our heroes right now and continue to be probably into 2021. And it's so important for organizations such as yours and mine at State Farm to recognize those who are really helping advance and move the ball forward as we kind of get our footing in the new normal, if you will. But I really want to thank you, Gustavo, let you know that we appreciate your support and the support of North Carolina Blue Cross Blue Shield with the Latin American Chamber of Commerce Charlotte. and look forward to continuing to work with you well into 2021 and the future and beyond. So thank you so much for your time.
Thank you, Todd, and it's my pleasure to be partnered with you and represent Blue Cross Blue Shield of North Carolina here at this time. Thank you.
Thank you.
Thank you. And now we're going to transition to a poll, which will be conducted by AT&T and our great friend Kathleen Evans, who is going to speak a little bit on how we have switched to the virtual world and high-speed internet. So everybody get ready, because this is going to be the interactive part of it. Kathleen, please unmute yourself and take it over.
Will do, Rocio. So let me do a quick technology check. Can you see me? And
no,
can you?
Oh, now we can. Now we can.
You
And
can
we
see
can hear
me?
you. Excellent.
Okay, and hear me. Oh, fantastic. So I'm so excited to be with you, Rocio, and to be a sponsor of the LAC Mid-Year 2020 Conference. Your speakers are phenomenal. And one thing Gustavo said that really hit the point for me was that 98% of his team is still working at home. That wouldn't happen without carriers like AT&T, which leads me into this wonderful poll, AT&T trivia poll. So let me read these questions to you. Question 1, how much has AT&T network traffic increased during COVID-19? Question 2, how is AT&T supporting small business? And then final question 3, how is AT&T supporting public safety agencies like fire, police, emergency management personnel, and healthcare workers?
Please ensure you scroll down the poll so you can read the questions and the answers.
And the answers are: question 1, how much has AT&T network traffic increased during COVID-19? Oh, good choice. It depends on how you measure it. All right, so the first answer, 22% of the traffic, business, home internet traffic, wireless minutes have increased 22%. But I gotta tell you that Wi-Fi usage has actually increased more than 55%. So I'll give it to you for 55%. Question 2, how is AT&T supporting small business? Brilliant. 90% said all of the above, you bet. AT&T provides coverage, 5G coverage to over 120 million people. We spend $14.2 billion with minority-owned businesses like women-owned business, service disabled veterans, LGBTQ+, and people with disabilities. In fact, AT&T was recently named to the Diversity Inc. Top 50 companies and to the Diversity Hall of Fame. We've invested more than $135 billion in our wireless and wireline networks over the past 5 years. And most recently, we were named the fastest wireless network in the United States. Well done, folks. And last but not least, How is AT&T supporting public safety agencies like fire, police, EMS, healthcare workers, and more? Yet nailed it again. 84%, all of the above. You're right. We've built the first ever national communications network dedicated to public safety called FirstNet. It works like a dedicated HOV lane. So any first responder on that network has priority and preemption. And in case of emergency, when networks are congested and you get a busy signal and can't connect, your EMS, your public safety calls goes through because we need you on the front line first. We've also been feeding public safety professionals during COVID-19. I've been personally doing a lot of that work, feeding the front line in Mecklenburg, sheriffs, fire, also our healthcare workers at our big hospitals, on and on, our hospitality workers, you can't get home. We are out there helping the community. And last but not least, we offer eligible public safety agencies free smartphones for life. Those are public safety agencies on that FirstNet network, free smartphones for life. But also know if you're a doctor, a nurse, or another public safety professional, and your institution or agency is not on FirstNet, you can still be on FirstNet on your personal phone. Again, AT&T is the only company in the country that runs two different networks, one commercial network and one for public safety. So thanks, well done, folks. You did a great job. Rocio, I appreciate being here, and back to you.
Thank you, Kathleen. And we are proud customers of AT&T, and you cannot believe how many phones and computers and lights we have coming up right here so that we can continue with the conference. Thank you, Kathleen. We really appreciate it. Now, we would like to move forward to present to you Patti Juarez. She is a National Diverse Segment Director for Wells Fargo, and she was joining us from California. So let's listen to Patti. Thank you.
Hello, everybody. I am Simon Munoz Alvarez, and I am honored to be representing Wells Fargo as a member of this year's Chamber's Board of Directors. Wells Fargo was the first corporate sponsor and has been a sustaining sponsor to the Chamber since 2011. This is one way that Wells Fargo is committed to connecting to the Latino community in Charlotte, as well as the surrounding areas. Today, I am joined by Patti Juarez, a ferocious Latina leader whom has paved the way for many, many Latinos, not only in our community, but across the United States. She is a respected Latina, a mother of two, an advocate for diversity and inclusion, as well as an overall extraordinary leader. Patti is the National Diverse Segments Director, as well as the enterprise-wide president for the Latino Employee Resource Group at Wells Fargo, known as Latin Connection Team Member Network. Patti, I saw you last September, and it is truly a great honor to see you again and to be able to have this conversation during this year's Latin American Chamber of Commerce mid-year conference. I am excited to share this audience with you, as well as be able to share how Wells Fargo is involved not only with the Latino community here in Charlotte, but at large. To begin, I'd love to start out by having you tell us about who Patti Juarez is. Tell us about yourself, your current role as the National Diverse Segments Director, and also the president for the Latin Connections TMN.
Simone, it's such a pleasure to be here with you all. I am honored and humbled to be here. I am so delighted that we got to see each other last September, and actually with a lot of the Latin American Chamber of Commerce leadership as well. Of course, these have been difficult times that we don't get to see each other in person, but glad to join you via Zoom, you and your members, and just really happy to be here. My name is Patti Juarez, as you said. I am the National Diverse Segments Director for Wells Fargo. My team and I are responsible for all the strategies around our outreach and everything we do around diverse segments. Our mission and our goal is to be the bank of choice for diverse-owned companies. What I realized, Simon, is that in a lot of the growth that we were seeing in our business relationships was that there were many minority-owned companies as part of those relationships. And so I thought that we needed to take a more proactive approach of going after that business. It is incredibly important to Wells Fargo. And so we have been working really diligently over the past 3 years that I formed this group 3 years ago. We started out with our women's segment and then quickly pivoted to our Latino segment, being the fastest growing, and have launched Native American, and we have also started our work around our Asian segment. All of these segments are growing. All of these segments represent the communities we serve, so we are super excited to be able to do the work that we do. We're also spokespeople, men and women, around the work that we do at Wells Fargo in diverse segments. And so you will see me traveling. Well, prior to COVID, you would see me traveling around 50-60% of the time, getting to visit with a lot of our team members and clients and prospects. And so I miss that, I really do. But in any event, now we have pivoted our strategy to really supporting those businesses through these tough times. And we'll go over some of the ways in which we have done that later in the call. But as far as my role as Latin Connection President, it is my pleasure and honor to serve as the leader of over 48,000 Latinos at Wells Fargo. We have one of the largest employee resource groups in the country. We are so proud. We have 50 chapters across the country. We have just a tremendous amount of passion and support of our team members, and they all work really hard to support the communities. And every year we log over 5,000 hours of community support. And as you know, and your partner, Jose, in Charlotte, you guys do tremendous work there. And we're just so proud of you guys and all the work that you do. So it is a privilege and an honor to be part of a Latin Connection and to lead this team. For me, it is important to elevate the Latino agenda, as it is very important that we take care of the needs of 48,000 team members. Some are entry-level team members, some are leaders in the company, but we need to ensure that everybody feels like they have opportunity and areas for growth at Wells Fargo, and that is a job that I take very seriously. I really try to focus on the needs of our members and listen to their ideas and implement those, because we have to come up with solutions. There are many areas that we could be doing better, just in terms of representation, maybe at the higher echelons of the company, and we're going to work really hard to ensure that that happens.
I love the Latino, elevating the Latino agenda. This is not the first time that I hear you say this. This is something that I have taken on as my personal goal, leading the Charlotte chapter, and something that I continue to say. It would not be fair for me to not talk about the current environment. We're currently living through a social unrest. We're obviously living through a pandemic. As I was preparing for today's conversation, I went through our emails, and you sent me something about a month ago actually, that read, and I'm actually going to read it. We are living in a strange time where a health pandemic has collided with a social injustice pandemic. I reflected on those words, and they were very meaningful to the text of the conversation. Asking you on a personal note, how have the past 4 months have been for you in managing and in navigating this new environment, and especially leading not only the diverse segments in the commercial bank, but also the ERG?
Absolutely. Well, it started out in the year where we were guns blazing. We have so many plans. We have so much to do. Just really setting the table, right, to execute all year on our business objectives for the company and diverse segments, and also for our objectives for Latin Connection. Of course, come March, things really change for us. I think got off a plane beginning the second week of March, and literally that week we were grounded and we were told, we can't get on planes. We need, this is really stay-at-home orders. And of course, our state here I live in California, we had a stay-at-home orders pretty early on. And so pivoting from a, really kind of business-driven agenda and all of these plans, all of a sudden we have a complete change of circumstances that have come to impact us all, right? So personally, for me, I started working from home, right? That's something a lot of our team members are doing at Wells Fargo. So I started working from home, but not only did I start working from home, my husband started working from home, and my kids needed to be also supported because they had online programs now for online learning. And while my 14-year-old can probably, take care of her own needs when it comes to that, my 6-year-old needed our attention and support to get through his online learning. And so from that perspective, personally, we had to pivot. We had to figure out, when are the times when I'm on calls versus my husband, who's going to support the children. And by the way, who's going to cook all those meals and, do all the work around the house that still has to be done. And so really, I think for us, it was just changing everything and really trying to appreciate the silver lining of some of the moments of, having that closeness with your kids and being at home, things that maybe I didn't get to do in a long time because I was traveling so much. And so from a personal standpoint, that was some of the changes were just adapting, setting up kind of boundaries and rules around the house on what's going to happen. And so we've been doing well in that regard. I know there's challenges and there's been interruptions of conference calls where my son needs a snack or something, but we've managed through it. In terms of our business strategy at work, obviously our whole purpose in diverse segments is to support diverse-owned companies. So what we have done there is we pivoted from being very much externally focused, marketing focused, really trying to grow the business from a marketing and prospecting standpoint, to being more supportive of our business community. Because as you know, COVID has come to wreak havoc with a lot of business owners. And so we made ourselves experts in paycheck protection program and other programs that our customers could take advantage of to weather the storm, right? To live through this pandemic, access some of these funds that are available. So I've spent a lot of time doing webinars, seminars, Zoom meetings, panels, just really educating and raising awareness and creating understanding around these programs, because it's always a little bit daunting for a Latino community to enter into some of these, loans, and this particular program was a loan to grant program. And so we needed to have an understanding of all the prerequisites and requirements and all of that. So we spent a lot of time supporting our community in learning about those opportunities.
I want to, one of Wells Fargo's corporate goals is corporate citizenship. The concept, the idea that making a positive contribution to communities through philanthropy or advancing D&I, as well as creating what you just mentioned, that educational piece of economic opportunities. Can you maybe share with us in this audience how Wells Fargo has contributed to the Charlotte and the North Carolina area, even using the Latin American Chamber of Commerce as a platform to elevate that knowledge from a Wells Fargo standpoint?
Yeah, absolutely. Well, I know for us, it's been all about partnering with the organizations that we have come to know and really appreciate for all the support they provide to small businesses. And so obviously in Charlotte, we mobilized, just many of our employees to support our customers, our consumers, our small businesses, all the Latino small businesses. And we have been supportive in many ways through our foundation, through our business, right, in PPP lending and other programs. We've also, through our foundation, supported huge efforts in our communities. And so we have been, I think, at the forefront of that as an organization. We have suspended residential property foreclosures. We have offered numerous, fee waivers, payment deferrals. I mean, if you can think about, the economic impact of this pandemic and the inability of some of our customers to make their payments, right? We've done we've helped over 1.7 million customers and small businesses deferring payments, $1.4 million worth of payments in the last few months. And we have continued to do many things in the community and in the businesses, serving our customers through our branches. I mean, we've only closed probably temporarily about 25% of our branches. So we have continued to serve our customers as they need us. On the small business front, we mobilized thousands of team members, thousands of employees to serve our clients in applying for PPP loans. As you can imagine, there was a huge demand for this program, and we had over 237,000 applications submitted to the SBA. And what really a point of pride for me there is that most of our loans that were funded, over 80% of the loans that were funded were for companies that had less than 10 employees. Our average loan size was $58,000. I mean, we really focus on helping the small business owner, and it is so critical. These funds were a lifeline for these businesses and remain a lifeline for these businesses. And hopefully at some point there'll be maybe even a secondary a Paycheck Protection Program loan that is available for business owners, because this pandemic has really lasted a lot longer than anybody would have thought. Through the Chamber specifically, we are so proud to partner with the Latin American Chamber of Commerce in our Avanzar program. It's a 6-month accelerator program for small businesses that want to take advantage of taking their business to the next level. We also participate in Leading Up, which is a program designed for developing the leadership and capacity of Latin American leaders in Charlotte. We participate in the Small Business Expo. We have in our community supported with a grant through our foundation, $250,000 to support the collaborative work of Financial Security Charlotte, and then another $150,000 to support the COVID Community Response Fund in Charlotte, which was managed by the Foundation for the Carolinas and the United Way of Central Carolinas. As a company, just our overall support we have committed $175 million to support the economic recovery of our communities, small businesses, and vulnerable populations affected by COVID. And I'm telling you that need is tremendous. And we are supporting need in 3 primary areas: our housing affordability pillar, our small business growth, and the financial health of our customers. Those things are at the forefront of what we're doing in terms of funding. So all to say that we're doing quite a lot. I'm so proud to work for a company that's so civically minded and that is making such a difference in our communities.
100%. I want to thank you for running us down through the amount of things that the company is doing. Take 30 seconds and, as a leader in your industry, tell us any words of wisdom that you'd like to share with the audience that's watching us today.
You know, Simon, to me, it's all about not losing hope. It's all about staying the course. We have to stay the course. And frankly, we have to support each other as Latinos. I mean, this pandemic has impacted our community in such an unprecedented way. I mean, we are disproportionately represented in terms of the cases of COVID, positive cases, as well as in the deaths and the death toll of this crisis. I mean, 25% of deaths so far related to COVID are Latinos. And we are only 18% of the population. So we're over-indexing in that. And so the economic impact of that to our community is tremendous. So I can only say that we have to stay the course. We have to support each other as a community. We have to be there for each other and really keep a positive outlook, because we can't just hide under our desk and pretend, and wait for the world to end. It's just not going to happen. We will get through this as we always have. But the more we support each other, the more we come together as a community, especially in this time of social injustice and everything that's going on. I mean, we have a health pandemic, we have an economic crisis, and then we have this social injustice. And so all that coming together and put it in a blender, and it's like chaos. And so the best thing we can do is lead our communities out of this and support each other in doing that.
Absolutely. Patty, thank you very much for joining me today, for joining us at this mid-year conference. Thank you for your time. We definitely appreciate it. Thank you all so very much.
Thank you. Thank you, Simon, for having me. Thank you to the Latin American Chamber of Commerce for inviting me. I'm honored to be here, and please stay healthy and stay safe.
Likewise. Stay safe, please. Gracias. Saludos. Thank you.
Adios.
I also want to thank on behalf of the Latin American Chamber of Commerce, because Wells Fargo has been our sustaining sponsor since 2010, and they believe in our mission, and due to their support and partnership throughout all these years, we have been able to provide all of those different programs that Patty mentioned. Now, I would like to send you again on a great ride of a breakout room. We're going to do some networking again. And then once we bring you back, after 5 minutes of having a chance to chat with one another, I am going to introduce to you to our motivational speaker to close out this conference. So hang in there, and I'll see you soon.
Hello, everyone. Welcome back. I am sorry for cutting you off. I didn't mean to, but I hope that you were able to get some contacts there and you can continue the conversation at a later time. Right now, I'm going to go ahead and hand it over to Rocio, and she will be introducing our final session for today's program.
Yes, thank you. And thanks everybody for participating. I know I was in the middle of it, and when I saw Debbie's note, 1 more minute, it's like, no, I have so much to say. But I'm very excited to introduce to you Justin Jones-Fosu. He is going to be our motivational speaker, and I'm going to be very fast reading his bio, but I'm going to read it all because it's very interesting. And he will be speaking about live at a different beat. Justin Jones-Fosu, MBA, CSP, is a full-time family man who also happens to be a highly sought-after business speaker, social entrepreneur, and meaningful work researcher. He is the founder and CEO of Work Meaningful, where he combines over a decade of leadership in Fortune 500 companies. His real-life experience and research to help global organizations create new rhythms of sustainable excellence, profitability, and engagement. Speaking over 60 times a year, Justin speaks and leads workshops and trainings in companies, organizations, and associations in the United States and internationally on meaningful work and workplace engagement. He is passionate about helping organizations and individuals take ownership of their mindset, purpose, and performance to achieve amazing results. His latest book, Your Why Matters Now, How Some Achieve More and Others Don't, challenges the reader to merge their purpose and productivity to get more out of work and life. He is all about turning events into a memorable and action-oriented experiences with his humorous and engaging delivery, as well as with his research-based content. So Justin, he's a great motivational speaker, a friend of mine, graduate of Leadership Charlotte. So if you like to take over and take us on a ride and help us finish our conference. Thank you.
Absolutely. So first of all, thank you so much for that great introduction. And if you could spotlight me, please, for the host. Spotlight also. So
go ahead.
Let's go. All right. We're going to dive into this, live to a different beat, and let's go. Hey, 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 hey. Hey, hey, hey. Awesome. So my name is Justin Jones-Fosu. I am super excited, super pumped to share with you. And what I love for you to do in just this awesome moment is I would love for you to, if you've had a great time at the conference so far, to put your hand up, to put the yellow hand up, or, to clap, do the clap thing as we engage, right? So if there's something that stands out to you that I share, I want you to do a TWG, or, oh, that was good, or just to type into the chat something that's helpful or a point of information that's helpful. So as we dive in these brief last moments and seconds, I want to share with you my drum experience. And so I don't know if we have some drummers out there, but sometimes in my presentations, this is what I have people do. So I'll have somebody grab a drum, right? And so we have a drum here. And I'm like, okay. So I just tell them, okay, now I want you to drum just for fun. And they're like, okay. Okay, cool. Now I want you to drum like you're drumming for someone you passionately love. And they're like, right, all right. Then I'm like, now I want you to drum like you're drumming and you're at the best party of your life. And you're like, hey, 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 hey. All right. Then I'm like, now I want you to drum like danger is coming. And the only way to warn everyone around you is with this drum. And they're like, now, what's interesting, if you've been able to tell, is that each beat was different. I love it. I love doing that at a live presentations. It's so awesome to see people come up with these different beats. But what's amazing is that the drum has stayed the same. The beat changed. Because the focus isn't necessarily on the drum, it's the meaning that we put into the drum that impacts what each and every single one of us gets to hear and to see. And when you don't like a song, you change the beat, right? And when you have a song that you love, what do? You turn up the volume. And that's the beauty of bringing meaning to what we do. And as you heard, it's not about bringing meaning or finding meaning in what you do. It's about bringing meaning to what you do. And over the day in the conference, you've heard a lot of great information and tools, and some things you said I can do, and some things you're like, I'm challenged by. But I want you to ask yourself one important and valuable question is, what is one thing that you can do to bring meaning to all the things that you've heard? What action can you take away to be able to say, you know what? Yes, there's a lot of finding meaning, this external environment out there. But when I ask the question, what can I do? It comes from within. So let me give you 3 ways that you can bring meaning and take what you've learned all throughout today and bring meaning to your everyday community, right? So one is the perspective rhythm, right? This is what I call my 3 rhythm model. And these are 3 ways that you bring meaning to what you do. Perspective rhythm. And in the perspective rhythm, I love the perspective rhythm because it's all about how you see something, right? How do you see something? So let me give you a quick story. Now, I remember I was flying back at one point, it's kind of pre-COVID, but I remember I saw this guy, and his name is Joseph, and Joseph was cleaning the trash in the Charlotte airport. And, I'm a person, I try my best to catch people doing things right. And so I went up to him and I was like, hey, I just want to say thank you so much for all the hard work you're doing. It's amazing. You make my experience in the airport better. And he just starts smiling. And he was like, I love what I do. And he dropped a gem on me. He was like, did you know that there is more trash in the Pacific Ocean than the size of the state of Texas. And I'm like, amigo, right? like help me, like understand, like I love this, because what Joseph did is he showed that it's not what you do, it's all about how you see it. It was his perspective. And I began to interview him, and he began to share how he loves to separate the trash and recycling, because he was all about making the world and the airport a cleaner and safe place. Joseph brought perspective to what he did. And that's the same thing that you and I have the opportunity to do after you've encountered all of today's teachings and lessons and great speakers and panelists, is to say, what can I do? How do I see the work that I do? How do I support our community in more meaningful ways? That's the perspective. The task rhythm is changing the specific things that we do. And I know many of you, you've gotten at least one action item, one thing. You can say, this is what I can do. This is a task. This is a mentoring opportunity. This is a time where I can write in and for policies. This is a place where I can donate funds, resources, time to support all the things that this amazing organization is doing. And you may say, what is that specific task that brings meaning to the work that I do? That's the task rhythm. And the last is the relationship rhythm. And that's all about, what are the relationships that you've been able to build, right? I saw some people passing out. Here's my work number. Here's more information that you need. But it's all about, who are the people that we invest in and that we better engage, right? Who are the relationships that we're building, and how are we building those tightly? And many of you on this call, you have the opportunity in this conference to mentor others, to be mentored by others, to have peer-to-peer accountability. But we can bring meaning based upon the quality of the relationships that we develop. Now, let me give you one practical way that I think developing awesome relationships can happen. And that's in what I call the extravagant appreciation experience. It's where you go out of your way to celebrate people around you. So, a small story. So I was this little kid, and growing up, one of the things about me growing up was, I had this awesome opportunity to grow up and live life and all these kind of things. And I remember, like, my mom came downstairs one day, and when she came downstairs, she was like, she saw that the dishes weren't done, right? And I tell people that, we grew up poor, but we had this fancy dishwasher named Justin Jones-Fosu. And one of the interesting things about this dishwasher is that sometimes this dishwasher didn't wash the dishes. And I remember, not washing the dishes, my mom came out, she was like, Justin, Peter Kofi Irabi Jones-Fosu, right? And you know that when your whole name is called, when your whole government is called, that you're in real trouble. It's almost like when the principal called you and you had to come down and the whole class was like, ooh, right? And so I remember, right, I came downstairs and she was like, Justin, you didn't wash the dishes. And when you don't wash the dishes, you invite bugs. And when you invite bugs, you invite roaches. And when you invite roaches, rodents come. And when rodents come, the world's coming to an end. So she would spend 10 minutes on all the things that I didn't do. And I remember like one day I was like, I'm gonna get her. So I remember I came downstairs, I washed the dishes, dried them, even put them away, right? And I came downstairs, and there was a little stairway to get to the kitchen, and you can also get to it from the dining room. And so I remember as I heard my mom come down the stairs, I magically appeared at the same time, like, and my mom was like, Justin, you wash the dishes. Good job. And proceeded to walk away, right? And I remember at that moment, I was like, wait a minute. She spent 10 minutes on all the things that I didn't do, but a simple just job on the things I did do. And my friends, I'm afraid we do the exact same thing with people in our lives, is that we can sometimes focus on all the things that they do wrong or don't do, that we forget to celebrate the things that they do well. And so I want to ask you and encourage you to find and identify ways that you can show extravagant appreciation. And I believe in this so much that I want you just to take 60 seconds. I want you to take in your phone. I want you to on your paper. I want you to send a text message if you have a phone, if you have a piece of paper, if you just in your mental mind, whatever you have. And in 60 seconds, I want you to identify at least one person that you can show extravagant appreciation to. One person. And for some of you, if you can do it right now, just let them know how awesome they are, the impact that they've had on you, and how much they've impacted the Latino community here in Charlotte. Whatever that is, just 60 seconds. All right, on your mark, get set, go, 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 go. 30 seconds. 30 seconds. All right. 3, 2, 1. All right. Now, what I'd love for you to do is in the chat, I'd love for you to share that one person that you could show extravagant appreciation to. Just type it in the chat, that one person that you need to show extravagant appreciation to. Right into the chat. That's part of our accountability to each other. One person. Go right in the chat now. All right, I love seeing this. This is good. This is good, y'all. Awesome. So with all that being said, there's one thing left for us to do, is to ask the question about our attitude. One last thing. So I ask you, by show of hands, how many of you all, if you saw this glass, would honestly see it as half empty? Honestly. Okay, but your little yellow hands, little applause, okay. All right. How many of you all, if you saw this glass, would honestly see it as half full? All right. How many of you all, if you saw this glass, honestly wouldn't even care, right? I know you, right? And the amazing thing, I remember going through one of the toughest times of my life. I was 25 at the time, quarter life crisis, yes, it happens. And I remember asking the question, is the glass half empty or half full? And I remember this motivational speaker came, it was just like, if you could just see the glass as half full, your life would be changed, it'd be amazing. I was like, dude, it doesn't work. But I remember going through this tough time, and I looked at the glass on the little the cabinet, and it was half whatever, some clear liquid, it may have been water. And I was like, I was 25. And I was like, glass, half full, half full. And then something hit me. It was like, Justin, why are you wasting your time asking, is the glass half empty or half full, when you can do this? You can fill the glass back up. And so I ask you today, how have you begun to fill your glass back up? Because it's easy to talk and ask the question, is the glass half empty or half full? But it's much harder to fill the glass back up. And so I encourage you, I implore you to find meaningful ways to fill your glass back up. Take the actions that you received, no matter where you are in this community. No matter what position you have, not position that you have, whatever how you come to this community, there's one thing that you can do to fill the glass back up in the community and to take from this conference what you've experienced and to apply it. What will you do? And one way that I believe in filling the glass back up is by action. All right. And I'm going to call my daughter with me over here. I would grab her real quick because it's powerful to have great action. And one of the things that I think that's super awesome is how we engage and how we work together. So Lydia, come here real quick. This is gonna be the last slide, or we're about to go off this slide. I would get my daughter real quick. And I want to encourage you to live to a different beat. And Lydia, come say hi to everybody real quick. So go say hi. Yay! And we're gonna go out. Let's see. We're gonna go out. Some really, really good. I don't know if y'all ready for this real quick though. All right. Live to a different beat, y'all. Apply action. I want to thank you so much. Woo! All right, oh, I'm gonna capture her. All right, little bitties. But I can't. All right, everybody, you have a great, great day. Hope you enjoyed the conference. Thank you, Rocio and company. Woo!
Thanks, everybody. This concludes our event. Thanks to the presenters, the participants, the board of directors, the LACCC team, and thanks to each and every one of you for joining us at the LACCC Mid-Year Conference 2020. Thank you so much and have a wonderful rest of the month. Bye-bye. Adios.
Bye, gracias.
Thank you.
Adios.
Gracias.
Bye, everyone. Thanks for coming.
Adios.
Safe. Thank you.
Cuiden mucho.
Cyber hug.
Muchas gracias.
Adios, amigos.
Gracias.
Hasta la venta.
Fill your
Great
glass
job.
up every day. Fill your glass up every
Adios.
day.
Bye. We love you. Bye.
Bye.
Mucho.
Thank you. Okay, Debbie.